Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Safety and the Older Adult, Episode 4, Microorganisms in Pre-Hospital Care. After viewing this episode, participants will learn about infectious organisms like ORSA, MRSA, VRE, and C. difficile. Participants will also understand how these organisms can be problematic for the older adult. Finally, participants will review ways to prevent the spread of these bacteria.
I would say in general, older people, those past the age of 60, 65, 70, generally have a lower degree of immunity to most infections. The first question that's been raised is what are ORSA, ORSA, what's MRSA, VRE, C. difficile, why are they worrisome, why are they important? All of these are organisms which can cause very serious infections. Not always serious infections. In fact, for many of these infections, they can be mild or trivial. And that's the case for ORSA or MRSA, which, by the way, are exactly the same thing. MRSA stands for methicillin-resistant Staph aureus, ORSA for oxacillin-resistant Staph aureus. It's really the same thing. These are staph bacteria which are resistant to the antibiotics we have traditionally used to treat staph infections. And that's why they're distinguished from other Staph aureus infections, because of their resistance to antibiotics. We can treat them, but we have to use newer antibiotics, and we have fewer choices. But most of the time we can treat them very effectively with those newer antibiotics. These bacteria, ORSA or MRSA, are carried by people just like other staph are carried by many of us. In fact, at any time, about 1/4 to 1/3 of all people carry Staph aureus, usually in the nose, but they may carry it in the skin, in the axilla, in the groin, moist areas in particular. But a large number of us walk around all the time, perfectly healthy, colonized with Staph aureus. Some of us are colonized with the resistant Staph aureus. The more you're exposed to antibiotics, either out in the community or in the hospital, the more likely you are to carry the more resistant types, because you've selected those out of all the Staph aureus you might carry because of antibiotic pressure that might kill off other staph, and then you carry the ones that are resistant. So carrying these organisms in and of itself is not a problem. It's when they get into places they're not supposed to be, causing clinical infection, that it's important. Now, most of the time these are skin and soft tissue infections that are caused by MRSA. They can be minor, fairly trivial infections, or more serious, but most of the time skin and soft tissue infections are self-limited. They may resolve themselves even without antibiotics, although we often treat them. The more serious staph infections can involve the bloodstream, the heart, bones, brain, virtually any organ in the body. How common are these infections in hospitals and nursing homes? Well, unfortunately, they're a lot more common than we'd like them to be. Now, MRSA accounts for approximately 60% of all Staph aureus infections in hospitals. Perhaps less so in nursing homes, but probably approaching that. If you have contact with people who have MRSA infections, it is possible you become colonized with MRSA, or at least for a period of time. But the risk in terms of having very serious MRSA infections is probably no greater for you than it would be from any other staph infection which you commonly encounter in your daily life, amongst your family, and so forth.
ORSA stands for oxacillin-resistant Staphylococcus aureus. MRSA stands for methicillin-resistant Staphylococcus aureus, and they are essentially the same. Resistant forms of bacteria come from antibiotic pressures. Many people carry these bacteria, but usually will present with a skin infection. More serious infection occurs in the blood, brain, heart, and various other organs.
VRE stands for vancomycin-resistant Enterococcus, another resistant bacteria which distinguishes itself because of its resistance to vancomycin, the drug traditionally used often to treat this enterococcus. Unlike the MRSA, this one tends to be less common and tends to prey on people who have weakened immune systems or are already ill in the hospital, often critically ill, have catheters, IV catheters, and so forth. So they're not as much a community type of organism as MRSA has become today. In the case of VRE, I would say the risk is practically nil.
VRE stands for vancomycin-resistant enterococcus. It is less common than MRSA and ORSA. It tends to prey on people with decreased immune response and people that are critically ill.
C. difficile is a bacteria that causes colitis, that is inflammation of the colon, and diarrhea. Usually fairly mild, easily treatable, but can be very severe, can be fatal, or may lead to colectomy or surgical removal of the colon. This almost always occurs in people who are already taking antibiotics for other reasons. And it's one of the reasons that we try to limit the use of antibiotics to people who really need them and not use antibiotics when they're inappropriate, say for the common cold. In the case of C. difficile, we've also seen a steady rise, particularly in the last, I would say, 10 years or so, and particularly strains of C. difficile that cause much more serious illness. So these are very serious infections, particularly in hospitals, less so in nursing homes, but anywhere people are taking antibiotics, there's some risk of C. difficile infection. Contact with the organism is less the problem than receiving antibiotics, which then lead to overgrowth of this organism in the intestine and the diarrheal illness.
C. difficile is commonly referred to as C. diff. It is a bacteria that causes colitis and diarrhea. It almost always occurs in people already on antibiotics, and it poses limited risk to EMS providers.
Because these organisms are on the skin and mucous membranes of people and the items that those people come in contact with. So they're on our hands when we touch patients, and they're on the equipment that we handle in the course of treating patients. So the only way really to stop spread of these things is to get them off of our hands as we go from one patient to the next, as we go from patients to equipment.
But most of our EMS providers are aware of skin infections, of staph infections, and I believe that usually we're doing what we need to do to protect ourselves, with the exception of maybe hand washing. That's been an issue over the last several years. I think it's getting better, but there's still an area that should be improved. Sometimes you just can't tell that someone has an infection. Sometimes the person is not presenting with any type of sign or necessarily a symptom. And sometimes the sign or symptom, especially the signs, are small, minute, and your assessment wasn't thorough enough to pick it up. However, it is smart, it's wise to get into routine of doing a good differential diagnosis, or even completing a full history, doing a decent physical exam on pretty much every patient. EMS has an opportunity to limit infections generally by being aware. There's not a lot that we can do as far as prophylaxis, but there's a lot that we can do in recognition, identification, and communication of any type of disease, no matter what it is. Ambulances, gurneys, any type of litter or patient care transport area is generally a place that's cleaned on a regular basis. But what it comes back to with any crew is a matter of routine. The truth of the matter is most EMTs clean on a need-to basis. We clean based off of suspicion. It's best for all of us, veterans and newbies alike, to get in the routine of doing some type of cursory cleaning after each and every transport. And that also goes with hand washing, because a lot of what we're doing is in the back of the rig, but it's very easily to take something from the back of the rig to the front of the rig.
The best practice for preventing the spread of these organisms is hand washing. EMS should frequently clean their equipment to prevent the spread. Although soap and water may be sufficient for your hands, additional products should be considered for cleaning of equipment. After viewing this episode, participants will learn about infectious organisms like ORSA, MRSA, VRE, and C. difficile. Participants will also understand how these organisms can be problematic for the older adult. Finally, participants will review ways to prevent the spread of these bacteria.